Dear students, you are again welcome to another session, to another lesson. My name is Moses Wanchiri. Today we are going to discuss another condition, and unlike the other conditions, this condition is not a psychiatric illness. This one is a neurological disorder. And what we are going to discuss is epilepsy. And we are having the following objectives. By the end of this session, you are expected to be able to define epilepsy and then to describe the beliefs concerning epilepsy, then to describe the causes of epilepsy and describe the types of epilepsy, and at the end we shall describe the management of seizure. Describe the seizure management. Now, to begin with, the word epilepsy comes from a Greek word that means to be taken, or to seize, or to attack. And therefore, epilepsy is also a word that means seizure. The word seizure comes from the word to attack, to seize. And therefore, epilepsy is also known as seizure disorder. Therefore, the definition of epilepsy is that epilepsy is a neurological disorder which affects the a condition that affects the nervous system and is characterized by sudden attacks of fits or seizure, and they have a tendency to recur. Now, the most important things here, the most important words here are sudden attacks of fits or seizures, and then the tendency to recur. So, that is what we call epilepsy. Now, epilepsy has many beliefs surrounding it, and the beliefs concerning epilepsy are grouped into those ones that concern the causes of epilepsy, those ones that concern with the contagiability, the transferability, how the disease is got or carried from one person to another, and some other beliefs are concerning the way the epilepsy is supposed to be treated. Now, when we come to the causation, to the beliefs about the causation, the public believes that epilepsy is caused by evil spirits, witchcraft, and maybe supernatural powers or forces, or the failure to respect the ancestors. And then they also believe that epilepsy can be passed on from one person to another through touch. Touching a person during the seizure, or inhaling air that the person has exhaled when the patient is breathing, and then you breathe in the air, the epilepsy gets you. Then they also sometimes believe that sitting together, even during a meal, can conduct epilepsy from one person to another. And then stepping over or going near to the spot where the person had a seizure, they believe that is the way epilepsy is passed on from one person to another. And therefore, having believed that, they now consider that epilepsy then has to be treated by a traditional healer other than being treated by the modern medicine, which are anticonvulsants. So they regard a traditional healer as a person who has the legitimacy for treatment of epilepsy. So having had those beliefs, then what are the appropriate response towards these traditional beliefs? One thing that you have to put in mind, that many of the patients with epilepsy do not seek modern treatment until they probably develop physical and mental complications. Although the priority should be taken to educate our patients about the real cause of epilepsy, the primary and tertiary prevention of epilepsy, one should avoid a temptation to be or to openly challenge the family held traditional beliefs, because then this one will produce negative attitudes towards you who is at least presenting these reactions or the information. They will develop negative reactions to you. Sometimes it may even cause hostility to the health worker, and it makes, even it gives a possibility of these patients and the community to reject the new ideas. So while approaching them, we should not openly challenge their family health beliefs. And therefore, we need to institute gradual and stimulating group discussions about the beliefs. And then at times these discussions should be within the framework of the prevailing cultural matrix. Having understood their culture, you now start stimulating group discussions or individual discussions about these beliefs, while gradually bringing in your ideas of the modern medicine. So when educating the patient, there is a need to emphasize early treatment as something that is necessary, and then you should not just your intention should not completely to win them off from the traditional healer or to the traditional beliefs, but you gradually introduce your ideas, and then you ensure that you introduce the idea in such a way that you make them to understand that taking modern medicine is also necessary, and then gradually they will now have their propulsion away from the ideas of traditional healer. Now, what are the modern known causes of epilepsy? Epilepsy is actually caused by brain damage. Although some genetic predisposition is also implicated, it is also believed that epilepsy, the ability, the vulnerability, the weakness for somebody to suffer epilepsy can be passed on from parent to offspring. And therefore, there is genetic predisposition. However, there is no known gene that carries the trait of epilepsy from the parent to the offspring. Then, brain diseases that attack the brain and sometimes cause damage to the brain, or sometimes irreversible damages. Things like febrile illnesses and maybe diseases that may cause direct injury by microorganisms attacking the brain are also implicated in the predisposition of a person to having seizures. Then we have also congenital abnormality, whereby some brain does not grow as expected, and therefore the movement of those small electric charges through the brain gets distorted or distracted, and leading to a seizure because of the congenital abnormality. And sometimes sudden withdrawal from addictive substances. If a person has been using psychoactive substances, for example, alcohol, and then he suddenly withdraws from those psychoactive substances, this person can develop seizures. So, the physiology of epilepsy is that individuals, just like any human being, there are small electric impulses that go through our bodies, especially in the brain or the central nervous system, in the nervous system generally. And therefore, these electric impulses are so minute that they can only be recorded on a machine called the electroencephalogram, EEG. But for a person to develop epilepsy, there is generally excessive and abnormal electric impulses which go through the brain and especially the cerebral cortex. So the person who develops epilepsy, these small electric impulses that go through our brain are usually generally excessive and abnormal, that they end up causing a sudden arrest of the brain and therefore leading up to a seizure. So these abnormal electric impulses can attack one side of the brain, but in most cases they attack both sides of the hemisphere, and when they attack one side of the brain, they cause a focal seizure. And when they attack both sides of the cerebral hemisphere, then they cause generalized seizures. Now, the onset of a seizure can be triggered by several factors. We know very well that a person may be having an epilepsy disorder, but all the time may not be having seizures. But the onset of a seizure can be triggered by certain factors. One of the factors is overstimulation of the sensory organs. This overstimulation can be stimulation of one of the five senses that we have. One may be the sense of sight by flickering bright lights, like these disco lights. Then we may have a repeated monotonous sound like music that goes on, monotonously. Then continuous stroking, or probably the skin, can also cause, can trigger a seizure. Then we have things like sudden emotional changes, which may involve excitement, which may involve depression, that may involve anxiety, and sometimes sadness, can trigger a seizure to a person who is predisposed to having a fit. Then, among ladies, menstruation the stress due to the menstruation can trigger a seizure. And this is probably why most people in our society consider that usually the seizures come when the moon is appearing. Then we have serious physical illnesses have capacity to trigger a seizure. Continuous movements, tiredness or fatigue, lack of sleep, stress. People who have seizure disorder and they also abuse substances like alcohol can easily trigger a seizure. Then trauma, and then the failure or not taking medications can lead to a seizure. Then there are seizures that can be provoked, even among other normal people who are not who are not having any injury prior that predisposes them to having epilepsy. Some seizures can be provoked, and these can be due to temporary events such as low blood sugar, alcohol withdrawal, things like low blood sodium. Then we have fever, things like brain infection, and maybe a concussion when the brain shakes within the skull. It is possible that the person may develop a seizure. So those are things that can provoke a seizure. And this provoking of a seizure is actually for even people who are not predisposed to seizures. So let us now go to types of seizures. Now, I want you to imagine a house that has been wired, and in this house there are wires that connect the lighting system from the meter box, and then there are wires that come from the meter box and connect the sockets. Yeah. Now, in case power is flowing and we are using appliances on the sockets, and we are also using lighting, something that affects the wiring in the house may affect only the sockets and therefore affecting only those ones, or may affect the lighting alone, or may even affect both the lighting and the sockets. And this is exactly what happens with the seizures. We said that they are small electric impulses that go through the brain. Now, if there are epilepsy that attacks there's epilepsy, a person has epilepsy can be in two ways. One, it can be considered focal. And focal is when the seizure or the abnormal electric impulse in the brain attacks only one side of the hemisphere. It can either attack only the left hemisphere or only the right hemisphere. And that is the focal epilepsy. At the same time, the epilepsy can attack both hemispheres. And when it attacks both hemispheres, it is called generalized epilepsy or generalized seizures. So, focal seizures attack one side of the brain, either one side of the brain, but either sides, one on the left or even on the right. Or it can attack both sides, and therefore when it attacks both sides, it is called generalized seizure. When it attacks one side, it is called focal. Now, focal seizures are also called partial seizures, and the partial seizures or focal seizures are of two types. Focal seizures are of two types, and there are those ones that are called the ones that occur with retention of awareness. We are not talking about consciousness, but we are talking about retention of awareness, which means the seizure can occur and the patient is aware that it is occurring. So it is a partial seizure which occurs with retention of awareness. And this one that occurs with retention of awareness is the one that was previously known as simple partial seizure. And then the one that occurs with loss of awareness, we are not talking about consciousness, but we are saying loss of awareness, is the one which is also regarded as focal dyscognitive seizure. This one previously was referred to as complex partial seizure. Complex partial seizure occurs with loss of awareness. And we are not talking about consciousness. Loss of what? Awareness. Then, those that are the two types of the partial or focal seizures. Then, with the generalized seizures, these are seizures that affect both hemispheres of the brain. In other words, the abnormal and excessive impulses affect both hemispheres. Just like the example I gave you, it is now an electric kind of short circuit that is affecting both the lighting system and the sockets. So it is affecting both. It's not affecting either lighting or sockets alone, but it is affecting both of them. And we are saying that it is generalized epilepsy or generalized seizures. Now, Generalized seizures are also categorized into several types. For the purposes of this lesson, we are going to have to talk about or to mention 6 types of generalized seizures. And the first one is the tonic clonic. The tonic clonic was previously referred to as the grand mal epilepsy or grand mal seizures or generalized convulsive seizures. Then we have one which is called absence seizures. And the absence seizures are previously the ones that were referred to as petit mal. And then we have the third one, which is the myoclonic seizures, which were previously referred to as the juvenile myoclonic seizures. And then we have the atonic, we have the tonic, and then we have the clonic seizures. And those are the 6 types of the generalized seizures. Now, the commonest type of seizure that is known worldwide is the tonic clonic seizure, and we are going to take some time to describe it. Now, it is the commonest type of seizure, accounting for about 60% of all seizure types. And this one may be preceded by prodromal periods or manifestations, and these manifestations include mood changes, behavior changes. There could be outbursts of aggression and so on. So the person may not may be aware of this one is happening, because these prodromal manifestations are actually not part of the seizure, and therefore the person may be aware of what is happening. However, as the situation progresses, the person may now develop what we call the aura, an aura or vague warning signs. And this aura is part of the seizure. And this one is characterized by strange feelings in the stomach. Some patients may tell you, I usually feel churning in the stomach. They may tell you that I sometimes smell things like they are frying onions, like there is something rotten, when actually it's not put there. They may even tell you they are tasting some things in the mouth. They taste some things in the mouth like maybe salt or lemon or even sugar, which is actually not put in the mouth. So at this point, if the person is aware of his condition, this is when a person takes a step to avoid danger. For example, if he starts having such symptoms of the aura when he's moving on the road, that's when he should go off the road and then go somewhere where he can be safe while having the seizure. So this one is actually part of the seizure, and for that matter, the patient, before he gets the attack, the real attack, may be aware when even is going for safety, but may not remember after what has happened when he was going to an area of safety, because this was part of the seizure. Unlike the prodromal symptoms, this was part of the what? Part of the seizure. So the person may not remember what happened, because he will have got what we call the retrograde amnesia. Now, following this, the aura, several events may occur. One, the person may become rigid and the muscles become intensely contracted, and he may lose consciousness, or he may become unconscious. In this phase, air is forced out of the lungs because all the muscles have contracted, and this one makes a sound which is popularly known as the epileptic cry, and the person may push out the air, and it makes a strange sound, which is known as the epileptic cry, because the diaphragm contracts, all the muscles of the ribs contract, and then they push out here air through the vocal cords. And when the air is passing over the vocal cords, then they make that sound, and the person appears like he's having what we describe as the electric cry. Then the bladder may contract, and therefore he may have incontinence of urine. At the same time, he may also have fecal incontinence. The jaws are clenched together. This one may lead to biting of the lips and then the tongue, and therefore end up with bleeding. And then, if the patient is standing, they may fall down heavily. And this one may cause serious injury. And all that is what we are referring as the tonic phase. The tonic phase. And in this tonic phase, the person may also develop what we call central cyanosis, because the breathing is halted, and therefore oxygenation to the body has been what? Impaired. And therefore there is the central cyanosis. Then after that, the person now relaxes into what we call the clonic stage, and it is characterized by relaxation, and then which is followed by a rhythmic jerking of the muscles, and then shaking of the body, which is called the convulsion. This rhythmic jerking is uncontrollable and goes on continuously into a tonic and clonic. Tonic and clonic. And that's why we refer to this seizure as a tonic clonic seizure. The other thing that may occur because of the biting of the tongue and the clenching of the teeth may close the part of the airway, and therefore pushing air through the clenched lip jaws, and which has bitten the tongue, makes a froth as the saliva flows out. And this froth may be even bloody, because the froth is mixed with the blood is mixed with the saliva and being pushed out as the person struggles to breathe. So at this time the breathing becomes erratic and he makes a froth, and this one may take a few minutes, like 3 to 5 minutes, and then there is gradual regaining of consciousness, and the person at this time may be dizzy, confused, and this is what we call the post-ictal phase or post-epileptic phase. The person may be disoriented for some like hours, and thereafter he loses memory of time and sometimes even disoriented to place. The person may complain of headache, may have a terrible desire to lie down and sleep, and sometimes they may remain unresponsive. Later they may become aggressive, and they have a disturbed behavior. This post-ictal state may persist for hours or sometimes even days, and after the patient may present with sores in the mouth, injuries that he sustained while falling down, and then he may have also severely bitten the tongue and destruction of the organs or structures in the oral cavity. So that is what we call the tonic clonic seizure, or the grandma seizure. And now the tonic clonic seizure may be subdivided into two main types. The tonic clonic seizure may be subdivided into two main types. We have the primary generalized epilepsy. The primary generalized epilepsy is that one whose cause is not clearly known. So it always begins in childhood or even adolescence. There is no structural abnormality of the brain to be found or to be investigated. Usually, a genetic predisposition is likely, and the prognosis is generally good with this type when the person is treated with the primary generalized epilepsy. Now, the second type is the secondary generalized epilepsy. With the secondary generalized epilepsy, the person is usually having a known secondary cause of the seizure. Sometimes it may be a treatment, it can be a metabolic disorder, it can be head injury, or a person having had an accident that obviously affected the brain, and the person is known to be having a seizure. So such seizures are more difficult to control. Secondary seizures are therefore more difficult to control because there is always a particular known cause of the seizure. Now, management of the seizure disorder. Tonic clonic seizures are usually frightening to the onlookers, but nurses should bear in mind how frightening this kind of condition is, and they are ready and prepared to handle. The following procedures should be taken while managing such a patient. Now, management of a patient with epilepsy, usually when they are not having the seizure, they are just like any other normal person. But usually our management is usually when he's having the seizure at that moment. Now, when a person is having a seizure, communicate with the patient throughout the seizure. Sometimes when the person is having a seizure, we may think that the person is not understanding, but you communicate with the person, then continuously give reassurance that the seizure will stop and the patient that he will not be left alone. Protect the patient from injuring his head or any other parts of the body, and try to turn the patient into recovery position, because when you turn the patient into recovery position, it helps the saliva to flow freely and therefore it may not choke him. Then do not force anything into the mouth. Previously, they used to encourage that whenever a patient is having a seizure, then you either put a stick or a spoon into the mouth. Please do not put anything into the patient's mouth, because then this one might injure the structures in the mouth, and sometimes if you succeed to put there either a spoon or a stick, it might even cause the person to lose his teeth as he bites the stick hard. So do not do anything as far as putting anything into the mouth. So all you need is to put the patient into a recovery position and make sure that the saliva flows freely, such that he does not take it into the airway and then it chokes him. Do not restrain the patient when he's having the convulsion. If the person is not having the convulsion, do not make an attempt to restrain him. And then usually these patients after the seizure drift to a deep sleep. Please note carefully and take observations to understand whether what the patient is having is actually deep sleep or is sleeping into unconsciousness. This one can be ascertained by patting the shoulder or touching his cheek or the chest to, as you call his name, to find out whether there is some form of grunting or even reaction to whatever you are doing. So that one should be taken really very important, seriously, because the person, as you think the person is now going into deep sleep, he could be actually slipping into unconsciousness, which could be a complication of the seizure. Then you have to check the patient regularly for breathing pattern, for the level of consciousness, and then you also need to ensure that the airway is open, and the person is breathing well. And in most cases, some patients may have another seizure just after the end of one seizure. So you make sure that if the patient is having another seizure immediately after the other, you go on to help the patient as we've been discussing. And this patient, such a patient, is really requires transfer to any place that is can offer better treatment for such patients who are having frequent seizures. And of course, when you are doing this, you do this in accordance to the policy of the land. Now, that is how we manage the seizures. Now, usually controlling the seizure is by taking anticonvulsants. And these anticonvulsants are taken according to the given prescription for a particular individual. However, there is a need to teach the patient about how to treat himself or how to carry on his day-to-day life to avoid injuries. So the patient should not go swimming, the person should not drive, the person should not ride, especially riding on a busy road, the person should not climb trees, the person should not go to a well, or even cook while having a lot of gadgets around him, which he can fall and get scalds or even burns when he's trying to prepare a meal. So these are some of the things that we need to educate the patient, and then also educate the community. Ladies and gentlemen, this takes us to the end of our session, and as our objectives were, we have defined epilepsy, we have described the beliefs concerning epilepsy, we have also described the causes of epilepsy, we have described the types of epilepsy, and lastly, we described the seizure management. And we also ended by talking about the precautions that a patient with epilepsy should consider. Thank you very much for attending, and I expect to meet you again in another lesson. Thank you.